everyone for coming out today. We are here to protest what's going on up here at the clinic. We want to stop them from privatizing it. They say they're not, but they won't say what they're doing. They say it's going to stay open, but who are they serving? This clinic was built from the ground up through the PAC committee. They had a whole name for it. So I'm just going to read you a brief history of the clinic. And this way it was presented to Vera Blue's family. Please accept this form. Please accept this framed copy of the brief history of the Cable B. Clark Health Center as a reminder of the central role your mother played in the development of the center. When I came to Potrero Hill with my family in 1972, I met three women, your mom, Ruth Willington, and Rebecca Paulnett. These ladies fundamentally changed my life. I met with them while I was organizing the Potrero Hill community government as an activist group to employ the community. These ladies, like my enthusiasm and good intention, but thought I needed a little grounding. Through a series of meetings in their homes, they advised me to be less radical and to listen to what the people in the community thought was the most important issue, which was not always my view of the need for revolutionary changes. I often think about those classy ladies and the impact they had on my life. All these ladies had intelligently strong characters, pride, worth, and a great sense of humor. They also had much love for the community and a clear vision of what the community needed to be a better place for them and their family. When you see the health center, always remember your mom, an important and driving force in this creation. For the last 35 years, it has provided excellent health care for thousands of people. It was an act of love. Now this here, that 35 years has grown because this here clinic was built before 1970, from the ground up. And now they're taking the community, the clinic from the community. A lot of the people was coming here, and they're not coming here anymore because they were turned away, and then they were placed someplace else. Once they get placed, they don't want to come back. And now the community is changing, but it's still that was built for the community, the people in the community. Everybody is not leaving Potrero Hill. But not only Potrero Hill, but there's 7 other clinics that was formed from the same group of people, so that people will have the health that they needed and could not get. We all was corralled down to General Hospital. By them expanding out to the clinics, we were able to have our own doctors, we was able to have our own dentists, we had lab work and all, and we only had to go to General Hospital for surgery stuff. So now the last person that they have placed out of this clinic, who's been here working over 20-something years, 37 years, they have sent her to the call center. Now, this person is our community research person. She's the glue to this clinic. She facilitates all over this hill, not only this hill, but then other communities, so that we are able to have the things that we need to strive on Potrero Hill. And that was Cheryl Thornton, and they said they didn't fire her, but they demoted her as far as I'm concerned. They sent her to the call center. The call center has been set up for over 3 years, and now I had a meeting with them and told them, you can't build up until you make sure that the foundation is there. So now they've taken her to build up that foundation. But what about the clinic? You've taken our foundation and our glue. This is not okay. We are not accepting it. And we don't have a director anymore. We don't have the staff that we're supposed to have, but you build in other wellness centers, but you can't even take care of the one that's here. So I didn't talk enough, but we just letting you know that we don't appreciate it. We don't need you privatizing us. We don't need you to treat us like we nobody. We need to let you know that other members that's in the clinic is also being moved around. When you go through that there, it used to be on every nationality. When you go behind them doors, it's very few people of color. They're changing them. They're sending them someplace else. And the, sorry, it took me a minute, but we have all these people that is upper management and things. We need the people, we need doctors. We don't need 3 directors and 4 officer directors and assistant to the director and the protician to the director. We need to have the doctors still, the doctors and the nurses, so that when the people come, they can be served. And they're changing all the names of the centers, and they're taking that money and putting it someplace else. But they're piggybacking off of the poor people. And I mean poor people, that don't matter who you are, you low income, and they said they're making affordable housing and so the clinic and stuff. But what's affordable? Can we afford what they're giving us? No. There we go. So we need for them to stop doing what they're doing to our clinic and other clinics that's in San Francisco. I done talked enough right now.
We want justice. 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 Now.
When do we want it?
Now.
When do we want it?
Now.
My name is Linda Wallace, and I've been a patient here for many moons.
Closer.
And so has my mom. Being so, she's gone on. But my issue with this clinic is being here and been coming so many years. The same thing. I can get the first thing in the morning appointment, still get behind an hour, 45 minutes. They call me at home. I canceled my 5th appointment on the 5th of this month because I couldn't make it. They gave it to me the same appointment on the 20th for $250. They tell me when I get here, my appointment is at 3:30. Every time I come here, I leave here with my blood pressure over, just out of whack.
Like, so she's on the Patient Advisory Council. She has been bounced around from doctor to doctor to doctor, and because of it, her health has been jeopardized because they're not staffing the clinic like they used to. Okay, and that's a problem. People, it takes you longer to get your medicine and everything.
I've been a resident here for 70 years because I was conceived and born in these projects. I know Cheryl Thornton along with her father for years. She has given me advice. She has given me different directions. Ask yourself, would you like to be here for 37 years and have someone tell you that you're not worthy to be here? She's taking care of the teenagers around here, the young generation. Who's going to do that now when they get rid of our clinics? Ask yourself, would you want to be put in this position? If not, then go with us and fight.
I am a resident here in Potrero Hill. I went to this clinic as a child. My grandmother is Roxy Harris's mother, and my grandmother fought for there to be equal health care and equal access to quality health care. And I feel like, you know, right now in these days and times, as the community is transforming, we must hold together the community that we still have as is, you know. And it's very important. My son, he's also a patient here at the clinic, and you know, it's just really important that people have familiar faces to basically see when they come into their doctor's office. I mean, I do know that the energy in the clinic has changed and transformed quite a bit, but I feel like it's certainly important for us to have access to the information and to know what's going on with our local community clinic.
Healthcare for the people, not the privatizers. Healthcare for the people, not the privatizers. Healthcare for the people, not the privatizers.
Oh, people stand up for their rights, and certainly health care is under attack. You know, they don't want to take care of the poor and the working class people in this town. You can't make money off of them. They don't want to do anything for you. Well, they'll give you a scooter now. You can pick up a scooter. We always tripped over them over on Gary Boulevard. And you don't wear a helmet, so you're going to need more health care facilities because these kids are going to be falling on their ass. and they're going to be running over people when they ride on the sidewalk. That's okay. See, that kind of stuff is okay. That gets first-class news all over the place. Over here, when they're closing down a healthcare facility to take care of the people of the city, the hell with them. And where are the politicians? Where are the union leadership?
But they can send the
That's what I
police
want to see.
help. We need help. We need for you to pay attention to what's going on. Look at the numbers of how many patients we had at this clinic compared to now. I'm not going to give you the figures, but somebody check it out. The numbers are going down. Why? Why we don't have the numbers? Why we don't have the staff? If people come up here, you're going to say, oh, well, we need the patients. Well, who's going to see the patients if they come here? We need justice. We need to be able to understand what is happening in our community. Stop treating us like trash. You're worried about these people with these guns. Like I said before, guns don't kill nobody. People do.
Yes.
And you're taking their homes away from them. You're taking the food away from them. What they gonna do? What are we looking at? You're taking the mental health away from them? What's gonna happen if we don't have these clinics to help these people out? We need everyone. We may be in small numbers today because of what's going on, but it takes more than one to raise your voice and let them know we want justice. We want peace. We want justice. We want justice.
It seems like Barbara Garcia and the bureaucrats, the high-paid bureaucrats in San Francisco, what they want to do is get rid of the nurses, get rid of the frontline care workers, and bring in more bureaucrats who are paid $200,000 a year. We don't need $200,000 a year bureaucrats and managers. We need more healthcare workers who do the work so people can get their appointments. And we are taking this up. It's not just at this center. Other centers are being privatized.
That's correct.
They want to gentrify San Francisco. They want to kick out the poor people, the working people, and put in $1 million condos. Now, earlier this week, we just had a press conference at the Federal Building because this shipyard over here, this Hunters Point shipyard, has poisoned a lot of people. There's radiation, there's contamination, and some of the poisoned people end up here for their health care. That's really what's going on. And who have they been poisoned by? They've been poisoned by the government, which brought in radioactive materials and then brought in ships and sandblasted them, put it in the bay, and contaminated people. And these people need health care. They need this clinic. Their families need this clinic. So why are they getting rid of one of the important workers at this clinic, Cheryl Thornton, who spent her life here working to help the people? Bring back Cheryl!
Bring back Cheryl! Bring back Cheryl! Bring back Cheryl! Bring back Cheryl! Bring back Cheryl!
Bring back Cheryl!
Bring back Cheryl! Bring back Cheryl! Bring back Cheryl! Bring back Cheryl!
Bring back Cheryl! Bring back Cheryl! Bring back Cheryl! Now, we had a rally at the Department of Public Health a couple weeks ago, and about 50 or 60 people, and people said that there's a racist hiring practice in the city and county of San Francisco. They're discriminating against African Americans. African American workers, Latino workers are being harassed out of their jobs in the city and county of San Francisco. Is that justice?
No!
Is that equality?
No!
Actually, that's what they want. They want a lily white or a white workforce in San Francisco, and they want to get rid of the people who built San Francisco. Working people, poor people, African American Latinos. This is a class issue. This is a working class issue because the people here deserve decent jobs. They deserve city jobs. They deserve decent health care. And Barbara Garcia and the city bureaucrats could give a damn.
Apartment.
Why don't you talk about that?
If you don't go to another apartment with bridge, they're bringing in the homeless to take over the people that they're evicting from here. So not only is the clinic in danger, so is our homes. Because why would you pick out a tenant and want to bring a homeless in?
That makes somebody else homeless.
Thank you.
They can say they're solving the homeless problem.
Yes.
Justice, no peace. No justice, no peace. No justice, no peace.
The harmony of liberty. Let our rejoicing rise high as the lifting skies. Let it resound loud as the roar. Your health centers are needed. What are you doing about them? You're tearing them down. You're letting them fall. You're doing everything that you're doing so that they will fall down. You're taking the glue, the people that help keeping them together with the communities. They're pulling them out. Where's the justice? Where's the justice? Where's the justice? Where's the justice?